What's going on, world? Welcome. Hey, today we are doing NCLEX questions. NCLEX questions. Welcome. Hey, you guys already know what the deal is. We are going to do NCLEX questions today. Hey, I need 100 people and I need 1,000 likes or we're not going anywhere. Last week, I went to a conference and I was gone all week. So sorry if you guys felt neglected. Sorry. But hey, sometimes we got to go do what we got to do. So if you guys are ready, I am ready. Let's get these questions knocked out. All right. Make sure you guys smash that like button. You guys share and you guys follow. I need 1,000 likes. I need 100 people in here or we are not going nowhere. But of course, I want to know who you are, where you're from, where you are at in your nursing journey. All right. Smash that like button, share. Let's follow. Let's see what's going on. My name is Kevin. I've been a nurse for almost 4 years. I've worked ICU, OR, and PACU. I was in the Navy for 16 years, as well as I've been an instructor / teacher / educator for almost 10 years. So what are we doing? Hey, I need 1,000 likes and I need 100 people up in here. So what are we doing? What are we doing? What's up? Appreciate everybody that's joining. We're about to do some NCLEX questions. Hey, I need 1,000 likes. I need 100 people up in here. I got some questions for you. Last semester, my ADN program, shout out to you. What's up? It's Olive P. Brown. Wow. Tamara, what's up? How are y'all doing? Hey, so we're going to be doing NCLEX questions today. Make sure you guys smash that like button. You guys share and you guys follow. All right. I got some questions for y'all. So, of course, I want to know who you are, where you're from, and where you are at in your nursing journey. What's up? What are we doing? Man, I guess y'all don't want no questions today. Ain't nobody showing up. Ain't nobody hanging out. Hey, we're going to be doing NCLEX questions. So it says, did my NCLEX today shut off at 85? I'm so sick to my stomach. That's okay, though. I'd rather you be sick to your stomach now than sick to your stomach while you were doing your exam. You know, you had control over that anxiety, and I'm super proud of you. Lily, what's up? Hey, you here? I'm glad that you're here. Make sure you let everybody else know that you're here, all right? Hey, y'all smash that like button. Y'all share, y'all follow. I was gone for a week because I was at a conference, and I had really bad signal, so it wouldn't have worked out anyway, but I appreciate everybody jumping on. We're going to do NCLEX questions. I need 1,000 likes. I need 100 people up in here so we can get this thing rolling. We got like 62 people up in here. All right. Hey, get carpal tunnel for me right now. Make it happen. Get carpal tunnel. All right. I would do it for y'all. But of course, I want to know who you are, where you're from, where you're at in your nursing journey. Hey, I don't care if it's your first time or if this is your 100th time taking this exam. I want you here. I want you present. I want you participating. I want you asking questions. I want you sharing with your peers down below. Okay. Hey, we got 100 folks up in here. Where my 1,000 likes at? Where they at? What are we doing? Happy Monday for everybody as well. Hopefully everybody had a good and safe weekend. All right. Could have been anywhere else. Hey, but you're here with me and I appreciate you. Liz says 2 weeks till I graduate. Love it. 8 years practicing, preparing for my NCLEX less than 2 weeks. Love it. I love it. What else we got going on? Hey, we're almost there. We're at almost 700 likes. As soon as I hit 1,000, I'm turning it around. NCLEX tutoring, I failed twice. I do coach and mentor for NCLEX. If you want to go check the link tree in my bio, and it'll take you directly there. Is that Shauna? So, hey, shout out to y'all. We got 100 likes. We got 100 people. We got 1,000 likes. So let's turn this thing around. Y'all already know what the deal is. Obviously, hey, we're doing NCLEX questions today. You know, we do them every Monday, Wednesday, and Friday at 5:30. Make sure you guys be here to participate in that. And here we go. Question number 1. A patient is admitted to the hospital with a diagnosis of hyperparathyroidism. A nurse checking the patient's lab results would expect which of the following changes in laboratory findings? Is it elevated creatinine or low PTH, elevated serum vitamin D, or low urine calcium? What are we thinking? Hey, if you guys are new here, welcome. Make sure you guys smash that like button. You guys share and you guys follow. We are doing NCLEX questions today. By the way, I got these questions off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. But of course, I want to know who you are, where you're from, where you're at in your nursing journey. All right. That's what I want to know. All right. Look at the keywords inside of the sentences that can give you your answer. And if you can't figure out what your question is asking, you can go to your answer choices. Remember, RTFQ, RTFQ, right? And then RTFA. And then when we finish, we go to RTFR, right? So shout out to you. Somebody said easy peasy. All right, well, let's see. Just started my bridge program. Shout out to you. I'll give you guys 15 more seconds. Lily's telling me A. Got A. Just started my LPN program 3 weeks ago. Shout out to you. Is it Kroof 96? Kroof? Shout out to Kroof. What is RTFQ? You must be new here. Somebody let BBBTT, let them know what RTFQ is. Let them know. You can guess too, by the way. You can guess. All right, here we go. Here's our answer. Read the full question. Sure, Michael, whatever. 22 years BSN. Shout out to you, ER nurse lady. All right, here we go, y'all. Here's our answer in 3, 2. And the answer is A, elevated serum calcium. The parathyroid gland regulates the calcium level in the blood. In hyperparathyroidism, the serum calcium level will be elevated. A normal PTH in the presence of hypercalcemia is considered inappropriate and still consistent with PTH-dependent hypercalcemia. PTH levels should be very low in those patients with PTH-independent hypercalcemia. A comprehensive clinical evaluation complemented by routine laboratory and radiological studies should be significant to establish a diagnosis of primary hyperparathyroidism in a patient with persistent hypercalcemia and an elevated serum level of parathyroid hormone. That is part of reduction of risk potential, which is 9 to 16% on the NCLEX exam. 9 to 15%, making it the 4th largest section on the NCLEX exam. So shout out to all of y'all that got that question right. If you did not get it right, this is where you circle back, get that content, and then keep going forward. All right. Don't let one question, take you out of the game. All right. This whole point is for you to practice. If you don't know it, go back and get that information. Okay. So shout out to y'all. Here we go. Question number 2. A patient with Addison's disease asks a nurse for nutrition and diet advice. Which of the following diet modifications is not recommended for somebody with Addison's disease? All right. Is it a diet high in grains, a diet with adequate caloric intake, a diet high in protein, or a strict sodium diet? What are we thinking? Victoria says D. Why? Why is that fun? Stop it. All right, what are we thinking? Hey, if you guys are new here, welcome. We are doing NCLEX questions. I got them off nurseslabs.com. My name is Kevin. I've been a registered nurse, BSN, if that really matters to you. I've been a registered nurse for 4 years. Worked ICU, OR, and PACU. And I was in the Navy for 16 years. So shout out to me, I guess. Shout out to all my other vets that are out there doing their thing, right? And of course, I want to know about you. All right. I want to know who you are, where you're from, where you're at in your nursing journey. Let me know down in the comments. All right. Remember, we're talking about Addison's disease. Addison's disease. I'm a cardio. Shout out to you, Victoria. Graduated in May. It says it's D, not B. Okay. D as a guess. Hey, I'd rather you guess and then understand why. If it's wrong, I'd rather you understand why it's wrong here than you try to do that on the test, right? My daughter has adrenal insufficiency. That's kind of cheating because you already know the answer. I'm just playing, but hey, take care of that baby. Here we go. What would be the time in Ghana? I don't know. I don't know what time it is in Ghana. I live in Texas. So here we go. Here's our answer. Here's our answer in 3, 2. And the answer is D, a strict sodium diet. A patient with Addison's disease requires normal dietary sodium to prevent excess fluid loss. Do not reduce salt in the diet. The client may need to add extra salt to his or her food during hot and humid weather or after exercise to replace salt lost through sweat. Do not use salt substitutes as part of health promotions and maintenance, which is 6 to 12% on the NCLEX exam. Addison's, add salt. There you go. Whatever works for you, right? Addison's, you add salt, all right? So shout out to everybody that got this question right. Remember, health promotions and maintenance is 6 to 12% on the NCLEX. It's a little bit smaller, but still very, very much important. Same thing for PNs. It's the same thing on your NCLEX exam. It's the same exact numbers, okay? So shout out to everybody. It says, I memorized this via cartoon on a PowerPoint somewhere. Hey, as long as you remembered it, right? I guess that's all that matters. So here we go. Question number 3. A patient with a history of diabetes mellitus is in the second post-operative day following a cholecystectomy. She has complained of nausea and isn't able to eat solid foods. The nurse enters the room to find the patient confused and shaky. Which of the following is most likely explanation for the client's symptoms? Is it anesthesia reaction, hyperglycemia, hypoglycemia, or diabetic ketoacidosis? What are we thinking? Hey, shout out to everybody. Hey, we are doing NCLEX questions. I got them off nurseslabs.com. Make sure you guys smash that like button. You guys share and you guys follow. Hey, we're on the road to 10,000 likes. If I don't have 10,000 likes by the time I get to question 10, I will boycott the rest of these questions. I'm just saying. Don't be stingy. Don't be selfish your whole life, okay? Give me them likes. Give them to me, all right? Here we go. All right, I'll give you guys 10 more seconds to see what we're doing here. I graduated in November of LBN. Shout out to you, hypoglycemia. I'm an RN from Michigan. Shout out to Michigan. I ain't never been there, but, shout out to you. Who gave my patient her home meds? Look, I can't even tell you, Victoria, I can't even tell you how many times a family member came in. They were just like, yeah, I gave her this pill from home. What pill from home? What pill from home? And then, we have a problem after that. But here we go. Here's our answer in 3, 2. And the answer is C. It is indeed hypoglycemia. The white one. Well, I got some horror stories, let me tell you. But yes, it indeed is C for hypoglycemia. A post-operative diabetic patient who is unable to eat is likely to be suffering from hypoglycemia. The actual treatment recommendation for a given patient should be individualized based on diabetes classifications, usually diabetes regimens, state of glycemic control, nature and extent of surgical procedure, and available expertise. All right, that's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Okay, 11 to 17% on the exam. Listen, management of care, pharmacology, physiological adaptation, and reduction of risk potential make up more than half of the NCLEX exam. And it doesn't matter if it's the PN or the RN, they both make up the same type of categories, okay? So shout out to y'all for getting those answers correct. Here we go, question number 4. A nurse assigned to the emergency department evaluates a patient who underwent fiber optic colonoscopy 18 hours previously. The patient reports increased abdominal pain, fever, and chills. Which of the following conditions poses the most immediate concern? Is it bowel perforation, viral gastroenteritis, colon cancer, or diverticulitis? What are we thinking? Amanda says bowels. Bowels. Okay. Everybody's screaming A at me. Okay. All right. Hey, perf. All right. Shout out to you, ER nurse lady. Anna's screaming A. Anna, I see you out there. I see you screaming at me. I got you. All right. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can definitely go over there and check those out for yourself. A little bit about me. I've been a nurse for almost 4 years. I worked OR, ICU, and I worked PACU. I also was in the Navy for 16 years as a hospital corpsman. I had 2 deployments. I've been a master instructor for the last 9 years. So I love coming over here teaching y'all because y'all give me all that good feedback. So I appreciate y'all being here. But let us check out what this answer is in 3, 2, and the answer is A. It's perf, according to ER nurse lady, right? It's a perf, bowel perforation. All right. Bowel perforation is the most serious complication of fiber optic colonoscopy. Important signs include progressive abdominal pain, fever, chills, and tachycardia, which indicate advancing peritonitis. Bowel perforation results from insult or injury to the mucosa of the bowel wall, resulting from a violation of the closed system. This exposes the structure within the peritoneal cavity to gastrointestinal contents. Patients presenting with abdominal pain and distension, especially in the appropriate historical setting, must be evaluated for this entity, as delayed diagnosis can be life-threatening due to the risk of developing infections such as peritonitis. That is reduction of risk potential. All right. That is 9 to 15% on the NCLEX exam. What's up, Queen? How are you? Reduction of risk potential, 9 to 15% on the NCLEX, which is the 4th largest section on the NCLEX exam. It doesn't matter if it's the RN exam or the PN exam. All right. Doesn't matter either one. All right. Still the same categories. The only thing that's going to be different is that you're going to see that the PN exam for management of care, it'll say coordinated care. Still the same concept. LPNs, you need to know what you can and can't do and what you can and cannot accept. You learn the same exact content that an RN learns. Trust and believe me, all right? Don't make it more difficult than it has to be. All right, here we go. Question number 5. A patient is admitted to the same-day surgery unit for liver biopsy. Which of the following laboratory tests assess coagulation? Select all that apply. Yeah, the good old Satan questions. The good old Satan questions. Anna saying A, B, and C. Anna is on it. Ariana saying ABC. All right. Hart saying ABC. Is it Adamari or Adamari? Did I say that right? ABC. I feel like it's Adamari. Kind of like calamari, but Adam. I'm just playing, y'all. I'm just playing. All right. What are we thinking? Yes, sir. All right, cool. Yeah. I said it right. That's what I'm talking about. Hey, and shout out to all y'all that are about to go take. Hey, first of all, shout out to all y'all that are about to graduate, because graduation is right around the corner. I want to let y'all know that y'all worked hard to get here, because trust and believe me, I know exactly what it feels like. All right. And y'all about to get ready for that NCLEX, baby. Y'all got this too. Here we go. Here's our answer in 3, 2. And the answer indeed is A, B, and C. It says, that's funny. The doctor used to call me calamari. It sounds like calamari. I don't mean no disrespect. That's all out of love. You know what I'm saying? Anna, shout out to y'all. Let's go. So we're talking about the prothrombin time, partial thromboplastin time, and the platelet count are all indicated or all included in coagulation studies. All right. The PT tests the function of all clot factors except for 7 and 13. PTT is commonly used in clinical practice to monitor patient response to unfractionated heparin infusion to target therapeutic anticoagulation, and as part of a coagulation panel to help elucidate causes of bleeding of clotting disorders. All right. Y'all can read the rest of them. I'm not going to read the rest of them. So, hey, y'all got them there. But shout out to y'all. That's part of reduction of risk potential, which is 9 to 15% on the NCLEX exam. Remember, it makes up half. Management of care, pharm, physiological adaptation, reduction of risk potential make up more than half of the NCLEX. There's 4 other sections. All right. Just know that this is what it represents. And if you don't understand that, you need to go back and look at your coagulation factors. They are important. But ladies and gentlemen, hey, I got some test taking strategies. Some test taking strategies to help you conquer the NCLEX. All right. They are free sets of like tips to help you. Who doesn't like free? You know what I'm saying? Go over there and check it out, thebootnurse.com/test, or you guys can go check the link out in my bio where it says free download inside the link tree. Go over there and get it. It's free. 42 pages of buttery, delicious goodness with that dude right there, minus his fanny pack, because if you don't got a fanny pack, what are you doing with your life? I'm telling you right now, the moment you bend over and all that shit falls out of your pocket, you're going to wish you had one. So go get one. All right. But anyways, go get those free test taking tips to help you conquer the NCLEX, thebootnurse.com/test, or it's linked in my bio. All right, here we go. Question number 6. A patient on the cardiac telemetry unit unexpectedly goes into ventricular fibrillation. Whoever the PA is, you better not answer this question. All right. The advanced cardiac life support team prepares to defibrillate. Which of the following choices indicates the correct placement of the conductive gel pads? All right. Is it the left clavicle and right lower sternum? Is it right of midline? Below the bottom rib and the left shoulder, the upper and left halves of the sternum, or the right side of the sternum just below the clavicle and left of the precordium? What are we thinking? Hey, if you guys are just now joining us, we are on the road to 10,000 likes. If we get to 10,000 likes, if we get to question 10, if I don't have 10,000 likes, my throat hurt. All right. Monique. Club Shay Shay style. All right. Play with me if you want to. You know what I'm saying? But hey, I want to know about you. I want to know who you are, where you're from, and where you are at in your nursing journey. All right. What are we thinking? Never mind. It's D. Come on, Matt. Matt, you got to read the question. My guy. But Matt's telling me D. All right. Canada. Oh, you're from Canada. I was like, Canada is not the answer. All right. Graduate. All right. I graduate May 9th. Hey, that's right around the corner. Hey, shout out to all y'all. I'm proud of every single one of y'all that are about to graduate. I'm proud of every single one of y'all because I know that the journey to get there is hard. I'm from the UK. Shout out to you, Miss Lady. May 11th for me. I know that's right, Sam. You're going to guess A. That's okay. I'd rather you guess here and understand why your answer is correct or incorrect versus where you get to your test and you get it wrong. All right. I just finished my prereqs and I start in the fall. That's what I'm talking about. All right, y'all, here we go. Here's our answer. Here is our answer in 3, 2. And the answer is D, the right side of the sternum, just below the clavicle and left of the precordium. Okay. One gel pad should be placed to the right of the sternum, just below the clavicle, and the other just left of the precordium. All right, as indicated by the anatomical location of the heart. To defibrillate, the pads are placed over, or I'm sorry, the paddles are placed over the pads. All right, according to the ILCOR guidelines, the sternal pads should be placed just to the right of the upper sternum border, below the clavicle, and the apical pad to the left of the nipple, with the center of the electrode in the mid-axillary line. All right, that's part of reduction of risk potential. It says Grey's Anatomy taught me where to place them. Stop it. You know, I've never seen not one full episode of Grey's Anatomy. It's really hard for me to watch it because I can't do the drama and half the shit that they do. I'm not saying it's wrong, but I'm just like, ain't no way. Hey, but I'm glad TV taught you something. So there we go. Reduction of risk potential, 9 to 15% on the NCLEX exam. It says it's inaccurate, but yeah, you're right. You're right. It is inaccurate, but it is spicy. I think I saw a clip where there was a bomb that went off in somebody's heart. I was like, that's all wrong. Everybody in there would have been dead. Every single person. But reduction of risk potential, remember, 9 to 15%, fourth largest section on the NCLEX. So shout out to y'all for getting that question correct. All right, here we go. Question number 7. The nurse performs an initial abdominal assessment on a patient newly admitted for abdominal pain. The nurse hears the nurse hears what she describes as clicks and gurgles in all 4 quadrants, as well as swooshing or buzzing sound heard in 1 or 2 quadrants. Which of the following statements is correct? The frequency and intensity of bowel sounds vary depending on the phase of digestion. In the presence of intestinal obstruction, bowel sounds will be louder and high-pitched. A swishing or buzz sound may represent the turbulent blood flow of a brewery, and it is not normal. Or D, all the above. What do we think? Hold on. Somebody said something. It says the bomb in the heart and cut. Hey, listen, the bomb in the heart thing, when I saw it blow up, I was like, everybody in that hospital, or at least on the next like 10 floors, are dead. Every single one of them. I don't think we understand how oxygen works. Oh my goodness. I saw that clip on TikTok, and now that I'm talking about it, TikTok's going to put it in my face. It said the oxygen would have, that's Ariana. That's what I'm saying. That's exactly what I'm saying. All right, y'all, 10 more seconds. Hey, if you guys are just now joining, we're doing NCLEX questions. We are doing NCLEX questions. I got them off of nurseslabs.com. They are free sets of questions. Go over there and check those out for yourself. It says, thank God for people in the medical field who really know their stuff. They should be paid. They really should be paid more. And y'all really going to see what life is like out here for my nurses. All right, but y'all got to be strong. But here we go. The answer is D. It's all the above. May know. Anybody? No? Whatever. All right, so all of the statements are true. Abdominal examination can be diagnosed or can give diagnostic clues regarding most gastrointestinal and genitourinary pathologies, and may also give insight regarding abnormalities of other organ systems. All right. A well-performed abdominal examination decreases the need for detailed radiological investigations, also plays an important role in patient management. All right. So we already know that that's part of physiological adaptation, which is 11 to 17% on the NCLEX exam. That's the third largest section on the NCLEX exam. Who said something? I saw somebody say something about a AAA. Emma, you are very much correct. We're looking at abdominal aortic aneurysm. Anytime you hear swishing or turbulent sounds, you know that is not what's supposed to be happening. All right. That is not what's supposed to be happening. It says, when in doubt, click all the above. That is not always true, Ariana. That is not always true. We do not always want to do that. All right. But for in this case, in the way that this question, all of the above is the correct answer. But the biggest thing is to know what section that it comes from, physiological adaptation. That includes chronic trauma, medical emergencies. A lot of big questions come from that section on the NCLEX. OK, here we go. Question number 8. A patient arrives in the emergency department and reports splashing concentrated household cleaner in his eye. Which of the following nursing action is priority? Keyword is priority. What is the very first thing that I want to do for this patient? Do I want to irrigate the eyes repeatedly with normal saline solution? Do I only place fluorescein drops in his eye patch, or patch the eye, or test visual acuity? What are we thinking? Who's screaming at me? Anna, is that you screaming at me again? Of course it is. Of course it is. All right. Shout out to everybody that's just now joining. We are doing NCLEX questions. I got these off nurseslabs.com. Okay, Anna. Got them off nurseslabs.com. They're free sets of questions. Here's another little thing about me, y'all. I failed my NCLEX 3 times. Dramatic pause. Not once, not twice, 3 times. Shocker, right? So I'm just letting y'all know. I'm just letting y'all know right now, nobody cares how many times you took that exam. Your job will never ask you. Your patient will never ask you. This test is about basic competency. You will learn how to be a great nurse when you start working as a nurse. Trust and believe me. If you're a shitbag before you become a nurse, you're going to be a shitbag nurse. Trust and believe me. So if you really want to understand what it's like to be out here, look, I'm telling you right now, you got to get out of your own way. So I failed my RT exam 3 times. Hey, that's okay, because look at you now, RT. How many times can you take it? It depends on your state. Where were you going wrong? There was a lot of things I went wrong. I had a job interview actually ask me. Well, that's funny, because they're not supposed to ask you that because it doesn't matter. All right, but here we go. Here's our answer. In 3, 2. And the answer is A, irrigate the eyes repeatedly with normal saline solution. All right, emergency treatment following a chemical splash to the eye includes immediate irrigation and with normal saline. All right. Immediate irrigation with normal saline. The irrigation should be continued for at least 10 minutes. Immediate irrigation with copious amounts of isotonic solution is the mainstay of treatment for chemical burns. Never use any substance to neutralize chemical exposure, as the exothermic reaction can lead to secondary thermal injuries. Irrigation should continue until the pH of the eye is between 7.0 and 7.4 and remains within this range for at least 30 minutes after the irrigation has been discontinued. That is part of physiological adaptation. Third largest section on the NCLEX exam. At 11 to 17%. All right, 11 to 17%. Who said that? Is it Goldie Love? Why would they ask you? That's a good question. I don't know why they would ask you. I've done plenty of nursing interviews and I've never had them ask me that, not one time, because in reality, it doesn't matter. It doesn't matter how many times you took the exam. You could lie to them and tell them you took it once. I'm like, hey, I took it once. Why does that matter? Who cares? Because like I said, in the end, what's really going to matter is if you are a good nurse or not. And only you can determine that. Period. Your exam doesn't determine that. I just want to make sure that you have the basic competency. But here we go. Question number 9. A nurse is caring for a patient who has had a hip replacement. The nurse should be concerned with which of the following findings: complaint of pain during repositioning, scant bloody discharge on the surgical site, complaint of pain following physical therapy, or a temperature of 101.8. What are we thinking? Anna's telling me infection. Fever is always no bueno. All right, cool. But yeah, like I said, I failed my NCLEX 3 times. I don't care. I tell everybody that. I let them know, because guess what? It doesn't stop me from going out here and doing what I need to do. So don't let yourself or anybody else try to get in your way of you doing what you need to do. And that's what I'm talking about. But here we go. If you guys are new here, I want y'all to smash that like button. We're on the road to 20,000 likes right now. 20,000 likes. I need all of y'all to get carpal tunnel for me right now. Make it happen. Make it happen right now. Everybody's telling me D. All right. I'm going to give y'all 10 more seconds. Got 40 D's in a row. All right, y'all. Here we go. Here's our answer in 3, 2. I got carpal tunnel from nursing school, bro. Bro, do I look like nursing school? Get carpal tunnel for me right now. Golly. God, gotta make things so difficult. My goodness. Anyways, the answer is D, a temperature of 101.8. Post-surgical nursing assessment after hip replacement should be principally concerned with the risk of neurovascular complications and the development of infection. A temperature of 101.8 post-operatively is higher than the low grade that is to be expected and should raise concern. All right. The THA post-operative wound complication spectrum ranges from superficial surgical infections such as cellulitis, superficial dehiscence, and or delayed wound healing to deep infections such resulting in full thickness necrosis. All right, deeper infections result in return to the operating room for irrigation, debridement, so incision and drainage, and depending on the timing of the infection, may require explanation of THA components. That's part of physiological adaptation. All right. 11 to 17% on the NCLEX exam. 11 to 17%, which is the third largest section on the NCLEX exam. Hey, you got to know where these fall under, okay? It says I'm writing for the second time and I'm starting to get worried about failing again. Hey, don't get worried about failing, all right? The only reason you should be worried about failing is if you have not put in the work to study. Remember, put yourself on a schedule, recreate the testing center, all right? Get rid of people. You're like people that don't need to be there. Have a good support system, right? Your time management, manage your time. It's a good vibes only out here. That's what I'm talking about. Ariana, let them know. Wait, are there no good vibes? Is somebody out here being wild? Hey, because you already know I'm going to ban that ass. That's what I do. All right. Hey, but seriously, like, don't be nervous about it. All right. Don't be nervous. If you put in the work like you're supposed to, you're going to conquer. Trust and believe me. Okay. It says study group is the key too. So some people can study in groups, some people can't. They can become a distraction. I like study groups that are in nursing school, maybe not so much for NCLEX. All right, here we go. Question number 10. A child is admitted to the hospital with an uncontrolled seizure disorder. The admitting physician writes orders for actions to be taken in the event of a seizure. Which of the following actions would not be included? All right. So 3 of these are included, which are incorrect answers. So which one does not belong? All right. Notify the physician, restrain the patient's limbs, position the patient on his or her side with the head flexed forward, or administer rectum diazepam. Got B's. B. We got one person saying C. Okay. All right. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. Also, make sure you guys smash that like button. You guys share and you guys follow. That is a trifecta for me to get out into the For You page. For however long TikTok's going to be around, I need to be in front of everybody's face. All right. So make sure you guys do that for me. And also, I want to know who you are, where you're from, and where you are in your nursing journey. Yes, I do have a YouTube channel. It is at The Boot Nurse. Everything is The Boot Nurse. My website, thebootnurse.com, my YouTube channel, The Boot Nurse. It's linked in my bio. You guys can check that out for yourself, okay? And yes, Anna, yes, the answer is B, restrain the patient's limbs. That is an incorrect thing to do, all right? It's part of physiological adaptation, 11 to 17%. On the NCLEX, making it the third largest section. I graduated in May. I graduated in December. I love it. I love it. During a witness seizure, nursing action should focus on securing the patient's safety and curtailing the seizure. Restraining the limbs is not indicated because strong muscle contractions could cause injury. Use and pad side rails with the bed in the lowest position. Or place the bed up against the wall and pad floor if rails are not available or appropriate. All right. It says my program ends in August. I graduate in December. Love it. Is it Rashana Guyana? Shout out to you. Alternative. Okay. Shout out to y'all. Just checking to see if I still my note. Hey, listen. You still got it. Who was that? A fit, stand firm? Ma'am, you still got it. All right. Hey, real quick, ladies and gentlemen. Hey, I have some free test taking tips over there for you guys. You guys can check it out over there on my website. It's thebootnurse.com/test. It's free. FREE. I'm just saying, go over there and look at it. Go get you that free download. It's 42 pages. You just don't get that fanny pack, baby. You know what I'm saying? Hey, I stay rocking that fanny pack. No, hey, don't judge me. When you start dropping shit all over the floor, you're going to know that you need to get you one. All right. But anyways, go over there and check it out. Get you some free test taking tips to help you conquer the NCLEX at thebootnurse.com/test, or it's linked inside of my bio. All right. Here we go. Question number 11. A patient who has received chemotherapy for cancer treatment is given an injection of Epoetin, right? Which of the following should reflect the findings in a complete blood count drawn several days later? Is it an increase in neutrophil count, hematocrit, platelet count, or serum iron? Or if you're from Baltimore, it's EARN. Oh, hey, I'm just playing. Anybody in here from Baltimore, hey, don't come for me. That's all jokes and love, okay? Don't do it. All right, what are we thinking? Baltimore. Oops, my bad, Amanda. Sorry. Baltimore. Y'all funny. Y'all are funny. All right, y'all. 15 more seconds. What are we thinking? Shout out to all 311 y'all. We're out here doing be more. Hey, we're doing NCLEX questions. Somebody says, I passed my NCLEX using, oh, my man, Zach is in the building. That's what I'm talking about. Zach, let him know. Hey, first of all, Zach took his NCLEX a few times. Congratulations to Zach. Welcome to the greatest shit show on earth, sir, known as being a nurse. If there's a piece of advice that you could give to everybody out here, what would it be? And once again, sir, congratulations to you. By the way, Nurse Glamber is in the building, aka Nurse Amber. She is an NCLEX strategist, and she is a homie. She is one of the homies, been the A1 since day one. She also does NCLEX prep. Make sure you guys go over there and follow her. Stop playing games. All right. Follow me, follow her. We got some stuff coming up for y'all. We're going to be collabing here soon. So make sure y'all go over there and y'all check her out as well. But here we go. Here's our answer in 3, 2. And the answer is B. It's an increase in hematocrit. All right. Epoetin is a form of erythropoietin, all right, which stimulates the production of red blood cells, causing an increase in hematocrit. Epoetin is given to patients who are anemic, often as a result of chemotherapy treatment. Epoetin alpha is 165 amino acid, the glycoprotein manufactured by recombinant DNA technology, which has similar biological effects of indigenous erythropoietin. Erythropoietin stimulates red blood cell production in situ. It is a hormone produced in the kidneys and augments the differentiation of erythroid, whatever that word is, in the bone marrow. Sorry. Hey, listen, there's a lot. I'm a nurse. I didn't say I could spell shit, okay? Or read it all the way out. Don't judge me. Pharmacological and parenteral therapies, which is 13 to 19%. 13 to 19% on the NCLEX, making it the second largest section on the NCLEX. All right. So make sure you guys understand, hey, when we talk about meds, when we talk about blood products, when we talk about IV therapy, all that stuff falls under pharmacological and parenteral therapies. All right. And by the way, you'll hear some people say, how are you a nurse and you don't know how to pronounce these words? Bitch, because I don't know. All right. How about that? That's nothing but love. Oh, hey, I love y'all. Happy Monday. We're going to the next one. Here we go. Question number 12. A patient is admitted to the hospital with suspected polycythemia vera. All right. Which of the following symptoms is consistent with the diagnosis? Select all that apply. My professor can't pronounce what? Satiety? Listen, okay? Okay. Whatever. Is it A, weight loss? B, increased clotting time, C, hypertension, D, headache, or E, tinnitus. So this is select all that apply. What do we think it is? What do we think it is? All right. Hey, if you guys are just now joining, we are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. Make sure you guys go over there and check those out for yourself. Make sure you guys go over there and check those out. I'll give you guys 15 more seconds. What are we thinking? Hey, if you're new here, I want to know who you are, where you're from, and where you're at in your nursing journey. I appreciate all the follows, but there's so many follows that are coming through, I can't even pick them all out. Anna's telling me A and C. Hunter, my man Hunter's in the building. Hey, if y'all don't know Hunter, my man just got his NCLEX too. Shout out to you, Hunter. Don't think I don't see you out there. My man saying B, C, and D. Shout out to you. Chicago, Chirac. What? Here we go. Let's see what our answer is. Texas, LVN, South Carolina. Love it. I live in Texas too. I live in San Antonio. So shout out to all my folks that live in San Antonio in the area. But the answers are B, C, D, and E. Shout out to Boston. All right. Polycythemia vera is a condition in which the bone marrow produces too many red blood cells. All right. This causes an increase in hematocrit and viscosity of the blood. Patients can experience headaches, dizziness, tinnitus, and visual disturbances. Cardiovascular effects include increased blood pressure and delayed clotting time. So shout out to y'all. It says, damn, I failed. I failed. Take my cert. It's okay, Callie. It's okay. Shout out to Ontario. I see you. Shout out to Hawaii. I've been there a few times. Oahu. You know what I'm saying? I've been there. But hey, that's physiological adaptation. All right. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Montreal. Shout out to Montreal. I see y'all. Canada in the building. You can take it again. You sure can take it again. Shout out to Cali, North Carolina. I was actually just in Asheville for a week. I was out there for a conference. So I like North Carolina. It's nice. I went to the Biltmore. If y'all have never been to the Biltmore or know what that is, they filmed Richie Rich there, y'all. I'm just saying. I was like, man, this house looked familiar. I like, look at the house off Richie Rich. Sure enough, it was the house off Richie Rich. So just saying. Shout out to North Carolina. Here we go. Question number 13. It is a beautiful mansion. It really is. A nurse is caring for a patient with a platelet count of 20,000 microliters, which of the following is an important intervention. All right. It says, oh, cool. Wow. That's something I didn't. Hey, that's great. Look it up. Look up the Biltmore in Asheville, North Carolina, and they'll tell you that's the house in Richie Rich. Is it A, observe for evidence of spontaneous bleeding, limit visitors to family only, give aspirin in case of headaches, or impose immune precautions? What are we thinking? Shout out to all 334 y'all. Hey, we are doing NCLEX questions. Make sure you guys smash that. Hey, we're on the road to 20,000 likes. Hey, we're on the road to 20,000 likes. Make it happen. Carpal tunnel for me right now. What are we thinking? What are we thinking? All right, give y'all 15 more seconds. Hope everybody had a really good weekend. Like I said, I was at a conference last week. To make my program better. All right, got to get that learn on. It says blood thinning indications. Okay. All right, y'all, here we go. Here's our answer. It says fun nugget. Give me one answer right now. I can't see anything. What do you mean you can't see anything? Here, I'm gonna back it up some. Fun nugget, you got to give me one answer. I'm waiting for Fun Nugget to answer. Once Fun Nugget answers, I'm going to do it. You help LVNs as well. Yep, this is both for LVNs and RNs. Fun Nuggets in here somewhere. There they go. Chat and say, okay, we're saying you're going to go with A, so we're going to go with the herd. All right, here we go. And the answer is A. Hey, remember, you can't necessarily go with the herd on your exam, okay? So if this is something that you don't know, remember, we want you to go back and I want you to go and look for those answers, okay? That's the only way that you're going to learn. Rationales help you retain the information that you are learning. Trust me, okay? So platelet count under 30,000 microliters can cause spontaneous petechiae and bruising, particularly in the extremities. When the count falls below 15,000, spontaneous bleeding in the brain and internal organs may occur. The blood clotting cascade is an integral system requiring intrinsic and extrinsic factors. Derangements in any factors can affect clotting ability. These laboratory tests provide important information about the patient's coagulation status and bleeding potential. The specific laboratory values to be monitored will depend on the patient's specific clinical condition. All right, so you have to understand, first of all, on NCLEX, they are going to give you the lab values. However, you still need to know what the lab values are, aka you need to know what their ranges are, because once you understand what their ranges are, and if I give you a range that is well under whatever the normal range is, you need to know what is being presented to you. I hear so many people say, oh, don't worry about memorizing them because NCLEX is going to give you the answers. No, you still need to know what could be presented to you. Regardless if you know what the normal ranges are. What if I had a platelet count at 40,000? Then what is that going to tell you? Hello? You see what I'm saying? Don't do that to yourself, all right? Because you'll set yourself up for failure, all right? But the answer indeed is A. It's reduction of risk potential, all right? That one right there was 9 to 15% on the NCLEX, all right? 9 to 15%, making it the fourth largest section. It says, can you please put a timer for us reading a question? I have a timer going on right now. It says watch these videos. It says watch these videos as much as I could and pass point. Shout out to you. I took my NCLEX today and failed for the second time. All right, Fashion Closet. So you took your NCLEX and you failed for the second time. So my next question is, when are you going to take it again? Are you going to lay down? Are you going to cry and you're going to let this test defeat you? Or are you going to get up, dust your shoulder off, and you're going to keep pushing? You let me know. Let me know which one you want to do. All right. I don't tolerate failure anywhere at all whatsoever. All right. Here we go. And you're only considered a failure if you truly quit. I'm just letting you know. All right, here we go. Question 14. A nurse in the emergency department assesses a patient who has been taking long-term corticosteroid to treat renal disease. Which of the following is a typical side effect of corticosteroid treatment? Select all that apply. Is it hypertension, Cushingoid features, hyponatremia, low serum albumin, or hypernatremia? A, D, E, A, B, E. Because that's from corticosteroid. Okay. I brush the sadness off and back to finding a new study. That's what I love to hear. That's what I love to hear. We don't quit around here. I don't allow quitters here, and I don't allow quitters around me, because I'm telling you right now, if you really want to be a nurse, if you want your dream to be a reality, you can never quit. It's okay for you to fail. It's okay for you to be unsuccessful. I don't care what no one tells you, because failures allow for you to see what you do wrong continuously so you can keep improving upon it. If you quit, you'll never know. And if you quit on yourself, you'll damn sure quit on your patient. Trust and believe me. If you quit on yourself, you'll quit on your patient. Don't tell me any different. The most important person is you. So if you quit on you, why wouldn't you quit on somebody that you don't know? You know what I'm saying? So shout out to you. It says, like, I'm going to find a new technique. I love to see it. It says that there's never quitting allowed. That's what I'm talking about. Ever. Here we go, y'all. Let's see what the answer is in 3, 2. And the answer is A, B, and D. So A as in alpha, B as in Bravo, D as in Delta. All right. So the side effects of corticosteroids include weight gain, fluid retention, and hypertension. All right. Cushingoid features: a low serum albumin and suppressed inflammatory response. Patients are encouraged to eat a diet high in protein, vitamins, and minerals, and low in sodium. That's pharmacological and parenteral therapies. All right, that is the second largest section on the NCLEX exam. It says, I love those devices. They going into my heart. What are we talking about? Anyways, so pharmacological and parenteral therapies, which is the second largest section on the NCLEX at 13 to 19%. LPNs, same thing. Same thing, LPNs. You guys use the same content that nurses have. Same content that RNs have. All right? Because LPNs are nurses. LVNs, you guys are nurses. Don't let a motherfucker tell you that you're not. I think you have 8 chances on NCLEX. That's not true. It depends on what state that you are in. Certain states only allow you to take 3 times before you got to go to remediation. Places like Texas, you can take it as many times as you want 4 years after you graduate. Places like Ohio, New York, I think Missouri, you have unlimited times you can take it. So it all just really depends. All right, here we go. Question number 15. A nurse is caring for patients in the oncology unit. Which of the following is the most important nursing action when caring for a neutropenic patient? So what is the most important thing when caring? First of all, we got to understand what neutropenic means. What does that mean? This is like, if you study, you will be fine. If you study, you will be fine. But some people, the NCLEX will truly tell you what type of studier that you really are. All right. Is it A, change the disposable mask immediately after use? B, change gloves immediately after use. C, minimize patient contact. Or D, minimize conversation with the patient. What are we thinking? Shout out to all 370 y'all. We're doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. My name is Kevin. I've been a registered nurse for almost 4 years. I worked ICU, OR, as well as PACU. If anybody's asking, I like the PACU the most. I love the teaching that happens in the ICU, but you know, when you get burnt out, baby, it's time to go somewhere else. And hey, listen, here's another thing. Do not feel bad about leaving a unit. Hear me. I want to see thumbs up in the chat. Do not feel bad about leaving a unit. If it is a toxic environment and if that's not conducive to your fucking mental health, fuck them. Leave them. Trust and believe me. All right? Because you are the most important. You are the most important. Stop playing games with me. All right? Stop playing games. All right. Because best believe if you leave, they will replace that ass. Trust me. All right. And I'm not trying to sell y'all that to scare y'all. It doesn't matter where you go. You can go to MedSurg, you can go to PACU, you can go to OR, you can go to ICU, you can go to wherever. All right. If it's not conducive for you and it's terrible experience, and if it's toxic, and if you're going home stressed out, pulling your fucking hair out, and it's truly not a good space for you, then leave. Then leave. All right. I'm just letting y'all know. Here we go. Here's our answer in 3, 2. And the answer is B. All right. Change gloves immediately after use. All right. That is part of physiological adaptation. Is that I see myself being an ICU nurse. Dreamy. Is it Dreamy Diana? Hey, do you, boo? I'm not trying to tell you not to go where you want. Go where you want. I want you to go where you want. If that's where your passion is at, please go there. All right. However, I want you to realize that no amount of toxicity is worth your fucking mental health. Trust me when I tell you that. I don't care where you work. I'm letting you know. All right, physiological adaptation, 11 to 17% on the NCLEX, making it the third largest section on the NCLEX exam, all right? The neutropenic patient is at risk for infection. Changing gloves immediately after use protects patient from contamination with organisms picked up on the hospital surfaces. If you guys don't know, hospitals are the dirtiest place on the planet. This contamination can have serious consequences for an immunocompromised patient. Wear gloves when providing direct care. Perform hand hygiene after properly disposing of the gloves. Okay. So shout out to everybody that got that question right. They said, how often do you do these lives? I do them Monday, Wednesday, Friday at 5:30 Central Standard Time. I live in Texas. So if you guys don't understand Central Standard Time, I live in Texas. Although Texas has 2 time zones if you're all the way out in El Paso, but whatever. I'm a Central Time, so you guys know what's up. Brianna, you are very welcome. All right, y'all. Shout out to y'all for getting that one right. Ladies and gentlemen, of course, lastly, right here, test taking tips to help you conquer the NCLEX. Hey, there's 42 pages minus my fanny pack because I wear that shit with pride. And you'll find out that you'll need a fanny pack once you start dropping stuff out of your damn scrubs. Hey, test taking tips to help you conquer the NCLEX. Go over there and check it out to help you conquer. All right, 42 pages. All right. Make sure you guys go over there and check it out. It's like I rock it during clinicals. That's Devontae. That's what I'm talking about, my guy. Hey, rock that because ain't nobody trying to pick pens up off the floor. You know what I'm saying? Here we go. Question number 16. The nurse is counseling patients at a health clinic on the importance of immunizations. Which of the following information is the most accurate regarding immunizations? It says, when is a good idea to start studying for? You mean when is a good time to start studying for NCLEX? It depends. If you're right out of school, you need to start, or if you're coming out of school, you need to be studying like anywhere from 2 to 3 months before you graduate. If you've been out of school for a while, you need to study at least you can study for a good solid 30 days and you can be ready, but that all just depends on you. All right. But is it A, all infectious diseases can be prevented with proper immunization? Immunizations provide natural immunity from disease. Immunizations are risk-free and should be universally administered. Or is it D, immunizations provide acquired immunity from some specific diseases? What are we thinking? We got some A's, we got some D's. Jenny, I didn't even realize you were here, Jenny. I'm sorry. I'm sorry that I did not acknowledge you. So hello. All right, we got some D's, we got some A's. Okay. We got D, we got A. Okay. Mostly everybody's telling me D. Is it a Kishna? Kishna, thank you for the follow. Appreciate you. All right, we got some more D's that'll be throwing out here. Okay, hey, if you guys are just now joining, we're doing NCLEX questions. Make sure you guys like, share, and follow. Smash that like button. You guys share, you guys follow. That is the trifecta. We are definitely on the road to 30,000 likes, so smash that like button. Get carpal tunnel for me. But here we go, y'all. Here is our answer. Here is our answer in 3, 2. And the answer is D. Immunizations provide acquired immunity from some specific diseases. All right. Immunization is available for the prevention of some, but not all specific diseases. This type of immunity is acquired by causing antibodies to form in response to a specific pathogen. Live vaccines are more effective than killing vaccines because they retain more antigens of the microbes. However, toxoids, including those that cause tetanus, not tinnitus, tetanus and diphtheria, are the most effective bacterial vaccines of all because they are based on inactive exotoxins that stimulate strong antibody production. All right, subunit vaccines, including Hep B, meningococcal, and Haemophilus influenza B vaccines, are effective when conjugated to carrier proteins such as tetanus toxoid. That is part of health promotion and maintenance, which is 6 to 12% on the NCLEX exam. Smaller section, but very, very much important. When am I still coming to Boca? I am. I am going to go to Boca Raton. It's going to be sometime in July. I have another conference I have to go to. So I don't know. We'll see. We'll see what I got planned to come out to Boca. It's nice out there. That's where the rich folks live. I'm trying to go hang with the rich folk. You know what I'm saying? So shout out to all 300 plus of y'all. We are rocking. Y'all are doing the damn thing. So I appreciate y'all. So let us keep it going. Here we go. Question 17. A patient is brought to the emergency department after a bee sting. The family reports a history of severe allergic reaction and the patient appears to have some oral swelling. Which of the following is the most urgent nursing action? Keyword is urgent. Most urgent. So what do I need to know? What do I need to do right here, right now? All right. So do I consult the physician, maintain a patent airway, administer epinephrine subcutaneously, or administer diphenhydramine, which is Benadryl, orally? What are we thinking? Airway is the most important. I don't know, Tiffany. It might be. All right, we got C's. We got, what else we got? We got C's, we got B's, we got D's. All right, I want y'all to read this. Let's read. All right, we're going to read it again. A patient is brought to the emergency department from a bee sting. The family reports a history of severe allergic reaction, and the patient appears to have some oral swelling. The patient is having oral swelling. They are in the emergency room. They are in the emergency room. All right, which of the following is the most urgent nursing action? So what is going away? What's happening right now? ABCs. ABC. Easiest 1, 2, 3. All the above. I have no idea from. Oh my God. All right, let us see what the answer is. We're about to find out what the answer is. Here we go. In 3, 2, and the answer is B. Maintain a patent airway. Maintain a patent airway, right? There we go. Maintain the patent airway. The patient may be experiencing an anaphylactic reaction. All right. Airway management is paramount. Thoroughly examine the patient for airway patency or any indication of an impending loss of airway. Perioral edema, stridor, and angioedema are very high risk, and obtaining a definitive airway is imperative. Delay may reduce the chances of successful intubation as continued swelling occurs, increasing the risk for a surgical airway. That is part of physiological adaptation. Physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. Medical emergencies, ladies and gentlemen. Medical emergencies fall under physiological adaptation, as well as management of care. All right. Remember, they are in the emergency room. In the emergency room, you have all the people, you have all the hands, all that stuff, right? We don't want to give an EpiPen. We need to, the very first thing that is required by us is to maintain that airway. You lose that airway, it's going to be so much harder for you to get it, because then they're going to have to get a surgical crike, and then that's a mess. That's a mess at that point. All right. We don't have to assess at this point. We already have enough information to know that we need to implement. We already have enough information to know that we can implement right now. All right. So shout out to y'all that got that question right. Remember, circle back, get that information. All right. Get that information, get that content. Here we go. Question number 18. A mother calls the clinic to report that her son has recently started medication to treat his attention deficit hyperactivity disorder, or ADHD. The mother fears her son is experiencing side effects of the medicine. Which of the following side effects are typically related to medicine such as ADHD? Select all that apply. So is it A, poor appetite, B, insomnia, C, sleepiness, D, agitation, and or D, decreased attention span? What are we thinking? You got ABD, BED, I think somebody said. ACE, okay. Hey, shout out to y'all that are just now joining. We are doing NCLEX questions. I got them off nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. I want to know who you are, where you're from, and where you are at in your nursing journey. Where are you in your nursing journey? All right. We're on the road to 30,000 likes. So make sure y'all smash that like button. Get carpal tunnel for me. All right, 4 seconds, y'all. Here we go. Here we go. Here we go. In 3, 2. And the answer is A, B, D, as in Delta, and E. BC, 20 years retired. Shout out to you, Miss Lady. Shout out to you. All right, here we go. ADHD in children is frequently treated with CNS stimulant medication, which increase focus and improve concentration. Children often experience insomnia, agitation, and decreased appetite. ADHD treatment commonly uses a combination of, the dextroamphetamine? Dextroamphetamine and levoamphetamine, as well as pure dextroamphetamine and lisdexamfetamine. Sure. Okay, there we go. Hey, pharmacological and parenteral therapies, all right? Second largest section on the NCLEX exam. Second largest section on the NCLEX exam. It says, so if we get 3 out of 4 correct, so we get partial. Yes, you do get partial credit on the NCLEX exam for select all that apply. You are very much correct. You do get partial credit now They changed that April 1st of 2023. No, it's not April Fool's. No, it's not a game. All right, so you do get that. And it's part of farm, second largest section on the NCLEX at 13 to 19%. 42 years as nursing, mostly spent in the ICU, retired 1 year ago. Shout out to you, 42 years. Hey, it's time to go. It's time for you to go and really relax. So appreciate you and all of your service that you have done for nursing. All right, here we go. Question number 19. A patient at a mental health clinic is taking haloperidol for treatment of schizophrenia. She calls the clinic to report abnormal movements of her face and tongue. The nurse concludes that this patient is experiencing which of the following symptoms? Is it comorbid depression, psychotic hallucinations, negative symptoms of schizophrenia, or tardive dyskinesia, or tardive, whatever you want to call it. Now, somebody's going to correct me, all right? And then somebody's going to spell it out in the chat, thinking I'm a 10-year-old on ESPN's fucking spelling bee somewhere. Tardive. Tardive. All right, I don't know this one. Brianna, give me a guess. If you don't know it, give me a guess. Tarvidi. Oh my God. See, I knew there was one. There was going to be one that was going to do it. Turdive. Tardice. What? There's no C in there. Trade discontinua. What? Tardaviae. Expecto patronum. Whatever. Here we go. Here's our answer. Oh my God. Here we go. And the answer is D. Okay. It's D. D. There we go. All right. Tardive dyskinesia. Yep. Abnormal facial movement and tongue protrusion in a patient taking haloperidol is most likely due to tardive dyskinesia, an adverse reaction to an antipsychotic. Okay. Tardive dyskinesia is a syndrome that includes a group of, iatrogenic movement disorders caused by the blockade of dopamine receptors. The movement disorders include, akathisia, dystonia, buccolingual stereotypes. Bro, these are words that I've never said. And if I said them, they were my first semester of nursing school. Y'all can read the rest of them. So pharmacological and parenteral therapies. Just say TD. All right, I'll just do that. Pharmacological and parenteral therapies, 13 to 19% on the NCLEX, making it the second largest section on the NCLEX exam. All right. Let me tell you something right now. Nursing students, you will never, ever, ever say these words. Ever. And if you write them on your chart, you can write them on your chart, but if you use these in normal conversation, one of your colleagues may punch you in the mouth. All right. So just know them for school. All right. Know them for school, know them for NCLEX. You won't have to know them anymore. I promise. Here we go. Question 20. All right. The patient or a patient with newly diagnosed diabetes mellitus is learning to recognize the symptoms of hypoglycemia. Which of the following symptoms is indicative of hypoglycemia? Is it polydipsia, confusion, blurred vision, or polyphagia? It says, I work in a hospital. We don't use those words. Exactly. Of course we don't. Hey, if you guys are just now joining, welcome. We're on the road to 30,000 likes. 30,000 likes. All right. Make sure you guys smash that like button. Make sure you guys share. Make sure you guys follow. All right. Also, I want to know who you are, where you're from, and where you are at in your nursing journey. What are we doing? All right. Mostly everybody's telling me it's not select all that apply, BC. It's just one. So are you saying, okay. Chattanooga, Tennessee. Shout out to you. Zambia, Maryland. Okay. All right. Blurred vision. Okay. All right. Graduate in 2 weeks. Shout out to you. Is it day? Hold on. EMT school. Shout out to you, Charlie. Man, TikTok can't let me be great. They out here trying to get me to verify. TikTok already be acting a fool, and they know they about to get canceled, and I'm not happy about that at all. Confusion. All right, well, let us see what the answer is. Chels, tell me what's up, Chels. Tell me what's up. And the answer is B. It indeed is confusion. Hold on, Chelsea's about to tell me something. Come on, Chelsea, tell me what it is. I passed. Chelsea, you passed what? I need for you to say it all out. Tell me what you passed. Tell me right now. She passed. Oh, no, I want to hear her tell me what she passed. She could have passed gas for all I know. Come on, Chelsea, where you at? Say it with your I pass NCLEX. Yes, Lord. That's what I'm talking about. That's what I'm talking about. Chelsea. Hey, if y'all don't know who Chelsea is, Chelsea was a frequent flyer, always here, always being present, always participating. Ma'am, I'm gonna tell you the same thing I tell everybody else. Welcome to the greatest shit show on earth, known as being a nurse. If there's a piece of advice that you could give to everybody out here that's going to take the NCLEX, especially these new ladies and gentlemen that are going to be taking it soon, what advice would you give them? And of course, once again, congratulations to you. I'm super proud of you for you doing your thing. I'm super proud of you. All right. Here we go. Hypoglycemia and diabetes mellitus causes confusion, indicating the need for carbohydrates. With a neuroglycopenic signs and symptoms are signs and symptoms that result from direct central nervous system deprivation of glucose. These include behavioral changes, confusion, fatigue, seizure, coma, and potential death if not immediately corrected. Physiological adaptation. All right. Third largest section on the NCLEX at 11 to 17%. All right, 11 to 17%, making it the largest section on the NCLEX. Chelsea, ma'am, you are the man. You are not the man. You are the person of, well, at least the next 30 seconds, okay? So I'm super proud of you. Chelsea came to my review that I did off of TikTok. You know, so many people participate in that, and I'm so glad that she was able to jump in there. So Chelsea, I'm super proud of you as always. Super proud of you as always. All right, hey, ladies and gentlemen. Once again, I have a PDF, free download, 42 pages, minus the glorious fanny pack that you see across my waist. Hey, my eyes are up here. All right, stop playing games. My eyes are up here. All right, test-taking tips to help you conquer the NCLEX. It's free, y'all. 42 pages. Go over there and check it out. Thebootnurse.com. Thebootnurse.com/test, or you can check the link out in my bio. My review, you can see it. It's inside the link, my link tree. I'm doing a review this coming Friday. No, next week. And right now it's going for $197 for 3 days. Samantha, what's up? How are we doing? All right, but make sure you guys go over there and you guys check that out. All right, thebootnurse.com/test. All right, here we go. Question number 21. All right. A child is admitted to the hospital with a diagnosis of Willem's tumor, stage 2. Which of the following stages most accurately describes this stage? The tumor is less than 3 centimeters in size and requires no chemotherapy. The tumor did not extend beyond the kidney and was recently resected. The tumor extended beyond the kidney but was completely resected, or the tumor has spread into the abdominal cavity and cannot be resected. It says, I was just practicing dosage calculation that came on your live. This was much needed. Who is that? Sunshine Boy. Hey, I'm glad that this is super helpful for you. By the way, if anybody ever needs help with dosage calculations, go over and see Nurse C. She goes by A Blessed RN over here on TikTok. I call her the dosage calculation queen. Hey, I'm telling you, she sits there and does dosage calculation questions all day long. And all day long. I want y'all to go over there and I want y'all to check her out. It is A Blessed RN and she'll get you right. All right. So what are we thinking? Shout out to all 400 plus of y'all. We are doing NCLEX questions. Man, let us see what this answer is. Sarah, why are we crying? Well, I ain't even say nothing. And the answer is C. The tumor extended beyond the kidney, but was completely resected. So at stage 2, the tumor extends beyond the kidney, but is completely resected. Stage 2 would be a tumor that has grown outside the kidney to some degree, such as in the surrounding fatty tissue. Usually the tumor would be completely removable by surgery, and regional lymph nodes are negative. About 20% of all Willem's tumors are at this stage. This is such as a chronic disease, which falls under physiological adaptation, right? Physiological adaptation being 11 to 17% on the NCLEX, the third largest section. Whoa, 50,000 likes. What are we talking about? I'm only at 31,000. I don't even know what's going on. All right. It says there's a great book, or great chart that was in my book that helped memorize the stages. Oh, shout out. Hey, Ariana, drop it down there and I'll post it. Hey, there she is, y'all. There she is. Nurse C. What's up, CC? Hey, I was just talking about you for dosage calculation. I'm about to send some people your way. So y'all, there she is right there. Nurse C. If you ever need it, that lady right there will get you right. That will get you right for, she'll get you right for, there she is right there. She will get you right for dosage calculations. All right. So y'all go follow her. All right. I just pinned her. You just followed. Love it. She going to get y'all right. Here we go. Question 22. A teen patient is admitted to the hospital by his physician who suspects a diagnosis of acute glomerulonephritis. Which of the following findings is consistent with this diagnosis? Select all that apply. Select all that apply. Oh my God, yes, thank you so much. You are very welcome. All right. We got urine specific gravity at 1.040, urine output 350 mLs in 24 hours, brown tea-colored urine, generalized edema, and or periorbital swelling. What are we thinking? It says, when are you doing the lives? She usually does them every day, I remember. So we got B and C. Okay. Remember, this is select all that apply. Select all that apply. Tay, baby, ma'am, what's up, Miss Lady? How are you? How are you? All right, y'all. What are we thinking? I'm gonna give y'all 15 more seconds. I want to pass. I want to pass my NCLEX on the first try. Okay, well, you got to study for it. You got to study for it. Here's a piece of advice for everybody. Study the hardest section that you have the hardest time with. So if it's pharmacology, start there. It does you no good whatsoever for you to study all your easy stuff first, because you already know that. Go to the hard stuff first. All right, here we go. The answer is A, B, C, and E. All right, A, B, C, and E. All right, acute glomerulonephritis is characterized by high urine specific gravity related to oliguria, right, as well as dark tea-colored urine caused by large amounts of red blood cells. As the glomerular filtration rate, or your GFR, is decreased, symptoms like edema and hypertension occur, majorly due to the subsequent salt and water retention caused by the activation of the renin-angiotensin-aldosterone system. All right. That is also part of physiological adaptation, all right, which is the third largest section on the NCLEX at 11 to 17%, all right? It says, I know this is not my thing, but I had to stop by and say hi. I'm great. Hope you're doing well. Ma'am, of course, you know how I do. I appreciate you stopping by. All right, what it says, I missed yours on Sunday. Hey, she got it. It says, yes, that's why I failed. Why did you fail, Grace? Tell me why. But hey, if you guys don't understand this, make sure you circle back. Hey, understand how the functions of our kidneys work, all right? Glomerulonephritis, that's talking about our filtration rate that's happening in our kidneys, right? So our kidneys aren't filtering. So what do you think is happening? Nothing's filtering. Things are going up. Look at it that way. It says Simple Nursing has a good video on hormones for aldosterone. Shout out to Simple Nursing. All right, here we go. Question number 23. Which of the following conditions most commonly causes acute glomerulonephritis? All right. Is it a congenital condition leading to renal dysfunction, prior infection with group A streptococcus within the past 10 to 14 days, a viral infection of the glomeruli, or is it nephrotic syndrome? What are we thinking? What are we thinking? Shout out to all 200 plus of y'all. We're doing NCLEX questions. For everybody that is new, make sure you guys like, you guys share, and you guys follow. We're on the road to 40,000 likes. We're on the road to 40,000 likes. So I appreciate everybody stopping by. Appreciate everybody stopping by to do their thing. All right. We got B's. We got B's. We got B's. All right. I'll give you 10 more seconds. We got D. Okay. Who does the dosage calculation class? It's nurse C. So a blessed RN. A blessed RN. All right, y'all. Here we go in 3, 2. And the answer is B, prior infection with group A streptococcus within the past 10 to 14 days, okay? So the answer choice is B. Acute glomerulonephritis is most commonly caused by the immune response to a prior upper respiratory infection with group A streptococcus. PSGN most commonly presents in children 1 to 2 weeks after a streptococcal throat infection or within 6 weeks following a streptococcal skin infection. Group A streptococcus has been subtyped depending on the surface M protein and opacity factor, which is known to be a nephrogenic and can cause PSGN. All right, that is it's physiological adaptation, which is 11 to 17% on the NCLEX exam. All right, making it the third largest section on the NCLEX exam. So shout out to all y'all that got that question right. There she is. There she is. I'm going to pin, CC, I'm going to pin you again. So everybody that's looking for the dosage calculation, that lady right there will get you right. All right. So shout out to everybody that got this question right. All right. We're going to move on to the next one. Here we go. Question number 24. An infant with hydrocele is seen in the clinic for a follow-up visit at 1 month of age. The scrotum is smaller than it was at birth, but fluid is still visible on illumination. Which of the following actions is the physician likely to recommend? Massage the groin area twice a day until the fluid is gone. Referral to a surgeon for repair. No treatment is necessary. The fluid is reabsorbing normally. Or keep the infant in a flat supine position until the fluid is gone. What are we thinking? What are we thinking? Shout out to all 211 of y'all. We are doing NCLEX questions. We're on the road to 40,000 likes. Make sure you guys smash that like button. You guys share and you guys follow. All right. Also, I want to know who you are, where you're from, and where you're at in your nursing journey. A little bit about me for those that are new here. My name is Kevin. I've been a registered nurse almost 4 years. I worked ICU, OR, and PACU. I also was in the Navy for 16 years. Last 9 years of my career was as a master instructor. I've taught a whole plethora of other programs, which is why I decided to come on here to teach y'all how to get right through NCLEX. Why? Because I failed 3 times and I passed on the 4th. So I'm just letting y'all know, hey, y'all can do it out here. If I can do it, y'all can do it. Trust and believe. All right, here we go. Here's our answer in 3, 2, and the answer is C. No treatment is necessary. The fluid is reabsorbing normally. A hydrocele is a collection of fluid in the scrotum that results from a patent tunica vaginalis. All right, illumination of the scrotum has a pocket light. Illumination of the scrotum with a pocket light demonstrates the clear fluid. All right. In most cases, the fluid reabsorbs within the first few months of life and no treatment is necessary. That's part of physiological adaptation. Once again, at 11 to 17%, making it the 3rd largest section on the NCLEX exam. Grace, I'm from DM, my first year, repeat. I want to be a nurse so bad. Hey, you can want to be a nurse, but we got to put that work in. All right. You got to put that work in. Understand where you're not doing well at, and that's where you start to improve upon yourself. All right. It says I was a medical assistant for 9 years, graduated LPN, take HESI on Wednesday, and then NCLEX. Shout out to you, Sunshine. I just took my Nike data. I don't even know what that means. I'm trying to decipher that. All right. He says, I'm trying. Hey, there's that good old saying on Star Wars. It was like, do or do not. There is no try. So we got to make that happen. All right. Here we go. Question 25. A nurse is caring for a patient with peripheral vascular disease. The patient complains of burning and tingling of the hands and feet and cannot tolerate touch of any kind. Which of the following is most likely explained for these symptoms? Is it inadequate tissue perfusion leading to nerve damage, fluid overload leading to compression of nerve tissue, sensation distortion due to psychiatric disturbance, or is it inflammation of the skin on the hands and feet? What are we thinking? A or D? Got to give me one. Give me one. Got to give me one. Hey, I just want to let everybody know we meet everybody where they are in their knowledge. Okay. Not like, don't be afraid. Don't be ashamed to answer. If this is the answer that you know, that's okay, because this is where you learn. This is where you learn. All right. And if anybody comes in here and they decide they want to act a fool, first of all, you're wrong. And I'm going to need for you to fix yourself. And I'm going to need for you to remember that you used to be a student. And 2, I'm going to ban that ass. All right. So don't forget that everybody is different in their learning structures. All right. I took my NCLEX for the 4th time and I failed again. Okay. So when are you taking it the 5th time? I'm sorry. All right, y'all. Here we go. Got A. Okay. Let's see. Let us see what the answer is. Here is our answer in 3, 2, and the answer is A, inadequate tissue perfusion leading to nerve damage. All right. Patients with peripheral vascular disease often sustain nerve damage as a result of inadequate tissue perfusion. Intermittent, claudication results when blood flow distal to the occlusion is sufficiently compromised, resulting in fixed oxygen delivery that is unable to match oxygen demand. The most severe form of PAD is cripple limb ischemia, which is defined as limb pain at rest or impending limb loss. That's part of physiological adaptation, which is the third largest section on the NCLEX at 11 to 17%. All right, 11 to 17%. Ladies and gentlemen, if you get it wrong, that's okay. Circle back. First of all, read your rationales to understand why you got it wrong. Read the rationales to understand why you got it wrong, and then circle back. How do you know the hard part on NCLEX? So when you fail your NCLEX, you will get what they call a candidate performance report. And that will tell you where you see below passing, near passing, above passing. The ones that are below are obviously the ones that you don't know. And that is where you start. That is where you start. How did you choose your floor as a new grad? I can't decide. I knew from day one that I wanted to go to ICU, and that's what I did. And I made it happen. So that's how you know. That's how you know. And if you don't know where to go, there's nothing wrong with going to med-surg. Now, let me tell you, med-surg is a specialty. I'm not shitting on med-surg, and no one else should shit on med-surg because that is a specialty. All right. So if at all points, if you don't know where to go, it's okay for you to go there until you figure out where you want to go. All right. Med-surg, look, hey, I'll tell you differently. Go where you want. But hey, Nurse Cece will tell you to go to med-surg. All right. I do these lives every Monday, Wednesday, Friday at 5:30. But of course, ladies and gentlemen, as we wrap up, I have some test taking tips over there for help you conquer the NCLEX. It is a free download. Go over there and check it out. It's 42 pages. 42 pages. Hey, it's going away, by the way. I'm about to switch it up and give you guys something new. So if you guys want those free test taking tips to help you conquer the NCLEX, it's a free download. Go over there to thebootnurse.com/test or check the link tree in my bio. It's the first one that says free download. Go over there and get it because it's free. All right. Free download over there for you. Okay. Now, free download over there for you. All right. And ladies and gentlemen, that is a wrap right now on the NCLEX questions. All right. I appreciate everybody stopping by and hanging out. We did it for a little over an hour. I did it for a lot longer than I wanted to. So, but hey, I appreciate everybody liking and everybody participating and hanging out. I didn't have to ban nobody, so I'm a little sad about that. I appreciate all the love and all the likes. While gifts are not recommended, they surely are appreciated. So thank you guys for all that. I didn't have to ban anybody. Usually when I say I give you a 600, that means I ban you for 10 minutes because 600 seconds equals 10 minutes, but I didn't have to do that. Once again, I got these questions off of nurseslabs.com. They are free sets of questions. You guys can go over there and check those out for yourself. I have an NCLEX course. You guys can go over there and check it out. You can get it for $97 right now. You can join it for $7. Right now, you can join it for $7. $7 for 7 days, right? And then it goes to $97. All right. So you guys can go over there and check that out. Get that free download over there. I have tutoring. I have an ebook and I have all that good stuff inside of my link tree. You guys can go over there and check those out for yourself as well. But of course, right now we're going to do like an Ask Me Anything. You guys can ask me questions. And my hair looking kind of gray, looking kind of rough. I'm sleepy. But how y'all doing? What questions do you guys have? What questions do you guys have about NCLEX, about nursing, about anything like that? My man Sunshine said, I appreciate you. I appreciate you being here. I really do. I appreciate you guys sharing. I appreciate you guys liking. So what other questions do you guys have? I got that scheduled. That appointment for you. Did you, D? Oh, that's right. You do. I think we're talking on Thursday, right? We're talking on Thursday. I remember. It says final tomorrow. NCLEX, the 3rd, 4th. What live review this week? Thanks. I think I have time. What do you mean, Don? I'm kind of confused. What's the difference between the NCLEX PN versus the RN? Scope of practice. It says hello. So $7 to join, then $97 after that for one time. No. So I didn't update this all the way. So it's right now I have it on a subscription. So it's $7 for 7 days. It's like a trial period. And then it goes to $97 a month. So Kelly says, I love your reviews. I appreciate you, Kelly. Thank you. Any tips for new nursing students? If you're in your first nursing semester, I would recommend getting into a study group, a small group, study group, and then splitting all the work up. And when you split all the work up, that way you do 25% of the work and you can reap 100% of the benefits. If somebody in your group is not pulling their weight, get rid of that ass and bring somebody else in that's going to work. All right. What about for the free questions? I'm sorry. Where did you go for the free? Oh, nurseslabs.com. Nurseslabs.com. Can you please give the category as to which area of the NCLEX is the highest? Management of care. It says, I got all near passing, 1 below and 2 above or near passing. So whatever one says, the one below, that's the one that you start with. Any tips for, I already answered that question. It says, good, let me know how it helps. Okay. What vital ranges are the right ones to know for toddlers for the NCLEX? The ones that are labeled? What do you mean? So whatever ones that are in there are the ones that are labeled. You said farm is the second highest. I did. Farm is the second highest. Farm is the second highest types of question that they're asked on the NCLEX. How do I get my test record from NCLEX? What do you mean your test record? Oh, you're talking about like your report. So if Pearson, you can get it by getting a hold of your board of nursing. And depending on your state, they'll either email it to you or they'll send it to you by mail. So mine look like this. You guys probably can't see it, but mine look like this, right? See where it says below, 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 above, below, near, near, right? And then this other one says near, below, near, 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 below, near. And I have another one somewhere and it tells you the same exact thing. All right. So start with the one that says below, because obviously that's the one that you are not proficient at. What does the NCLEX give us? Oh, wait, does the NCLEX give us the ranges even for vitals? No, they don't give you the ranges for vitals. They give you the ranges for like for lab values. You need to know what the ranges are. It says, Kevin, I took my final today and I got a 90. Megan, that's what I'm talking about. Super proud of you. I had no doubt that you were going to do your thing. They give it for labs. I'm starting to think this isn't for me. You're starting to think what isn't for you? You're starting to think what isn't for you? I'll be completely honest. Like nursing may not be for a lot of y'all. It may not be. If you at any point in time don't want to understand struggle, then it may not be for you. I failed 4 times already. So I failed 3. What's your point? So you're going to quit? I bet you a long time ago, you said to yourself, I really want to be a nurse. I really want to take care of people. Somebody took care of my grandma. Somebody took care of my mom, and they were wonderful people. And then you sought out on that journey. And then now when the journey is getting rough, you're just like, I don't want to be a part of it. How do you think the rest of them felt? It's not meant to be easy. Remember, all these things that are put in front of you to be a nurse are to keep people out. So if you're not destined, if you're not willing to work hard to get over that hump to come play with the rest of us that are nurses, if you're not willing to put in the work, then what are you doing here? It's frustrating. I cry like never before because I want this so bad because I love this field. Then what you're going to do is that you're going to keep where everybody's story is different. Everybody's story is different. Nobody's story is the same. Everybody's journey is different. While the destination may be the same to get your license, the journey to get there is very, very different. All right. So if you fail 4 times, cool. That's a part of your journey. It is. Not everybody's journey is going to be the same. All right. Take it as many times that your testimony to help. Exactly. That is your testimony. Yo, we passed NCLEX. That's what I'm talking about. Ma'am, welcome to the greatest shit show on earth. Welcome to the greatest shit show on earth, known as being a nurse. If there is a piece of advice that you could give to everybody, what would it be? Once again, congratulations to you. All right. It says, was there a lot of dosage calculations on NCLEX? No. So on my NCLEX, on the first time I took it, I have 1. Second time I had 2. Third time I had like 2. And on my last time I had 0. I had none. All right. It says, didn't pass the first time. I got a lot of near passing and 4 below, and it turned off at 85. So the 4 below, those are the ones that you got to stick with. You're very welcome. Am I close? Yeah. I mean, I think that you're pretty close, but you got to start off with those hard sections. It says, I was never supposed to make it this far, but here I am. Keep going. No, here's the thing. You pass NCLEX and you get a license when you're supposed to, not when you want to. If everything is lined up the way that it's supposed to, like you studying and hitting those wickets like you're supposed to, there should be no reason why you shouldn't pass. What ranges for vitals for peds should we learn? All of them. You need to know what the ranges are for kids. So I need to know that kids are going to have high heart rates. Or if I'm looking at late decelerations, like when I'm talking about in utero, I don't want to see a baby drop their heart rate from 150 all the way to 110. That's concerning for me, right? Oh, that's what you're trying to ask. Okay, so yeah, you need to know them all. You need to know them all. Lord forbid I don't pass. However, I take it again and I'm not giving up. That's right. No calculations for me. Look at that. She just took her exam, passed, and she didn't have to worry about any dosage calculations. People now are saying you need to get an EKG. You need to get an EKG quiz or question that if you do get it on the NCLEX, you pass. No, that's not true. So here's the thing about NCLEX. NCLEX is a computer adaptive test. So how you answer your question, whether it be right or wrong, will determine the next question that you get. So if you get it wrong, they're going to give you a slightly easier question. If you get it right, they're going to give you a slightly harder question. The more you get right, the harder the questions are going to be. If you start to get them wrong, they're going to start giving you slightly easier questions. The more you get wrong, the easier the questions are going to get. So if you start seeing questions that are just like, hey, what's a normal blood pressure? You might want to start, the red flags in your head might want to start going off being like, oh my God, this is a very easy question. Why are they asking me that? Probably because you're not doing so well. That's not to scare you, but that's for you to recognize what you're seeing. All right. This is, I just so many saying that I'm not listing. So I'm not exactly, is it is? I'm not sure exactly what you're saying on that one. It says, what did you do differently that made you pass the fourth time? Time management, accountability. I had a study calendar. I looked at this breakdown and I started with my lowest sections first. I had actually a study calendar. I created a tracker for myself, to show where I was deficit at, all these different things. And I had a sort of good support system, right? But at that point, I kind of cut everybody off because I was on this mission and I didn't need any distractions from nobody. So that's what I did. It says you need to know your content. It's very broad, and I passed in 85 questions. There you go. How long should I study if I'm a repeat test taker with a short schedule to study? So here's the thing. So many of y'all that are just like trying to rush this process, stop rushing the process. Like, give yourself time. Give yourself a good 30 to 45 days. Hell, give yourself 45 to 60 days. I think if you gave yourself a more time so you can absorb the content, I think you'd be okay. But so many people are just like, I got this job. Who gives a fuck about that job? These hospitals and these places out here are dying for y'all. All right. So if they have to wait an additional, 2 weeks to a month or a month and a half, who cares? As long as you have to take this exam again. Right. So my recommendation to a repeat test taker is at least 30 days. And I say at least 30 days. Could be more, but it all just depends on you. It says, but why are they doing this to us? It's part of the journey. It's part of the journey. Yes, mine started to get easy and I knew I wasn't doing well. So when you start to see that they're starting to do well, when you start to see that you're starting to do terrible, that's when you really have to slow down, read your question, read your answers, and then answer them correctly. All right. Because at that point, nerves and anxiety is going to start to take over. And as somebody who has been in that position, you got to fight through it. One word of advice: do not use too many resources while studying. I used Archer for 3 weeks and passed. So TJ said, I agree. I agree with you when it comes to using just, use like 2 resources. Nurse Amber, she'll tell you to use 3. I only like 2, right? But studying for 3 weeks, that worked for you. Some people is a month. I tell people at least 30 days, right? But some people need 45. Hell, I've helped coach people from 7 days, 14 days, 21 days, whatever. So it all just depends. Did you go in the morning? I went in the afternoon. I took my NCLEX at 1:00 in the afternoon because that's when I would usually do a quiz or I do a computer adaptive test or whatever. So I kind of kept it in that mode. Is there any way to request the breakdown? So if you've already taken the NCLEX and you failed, you can request your breakdown from your board of nursing. So true. I'm having a baby in May and I'm taking my test in August. I'm giving myself 60 days to study. I love that. Give yourself the time. Thank you. Your words are helping me keep going. Keep going. No, listen, no one's going to be able to accomplish this goal but you, period. You know what I'm saying? I can't, like I tell my other students, I have my license. I can't want it more than you. So you have to take all these external factors and you got to get rid of them. All right. Because remember, I want you to temporarily offset yourself so you can set yourself up permanently with that license. All right. Do you feel like what you learned in school aligned with what you saw in the NCLEX? No, I don't. Now, when it comes to the basic content, yes. Now, when it comes to answering NCLEX style questions, no, they did not. I was wondering what resources I should use. I have an NCLEX review that you can check out. It's inside. You can go check my link tree. It's in my bio. If you're looking for good questions, Archers has good questions. UWorld has good questions. Those are the two that me and Nurse Amber we highly recommend for our students to use. But Amber likes UWorld. I like Archer. Either one will work out for you. Our instructor said taking the test ASAP after graduation is the best according to stats. She's very correct. The reason being is because the longer that you are out of school, the more you start to lose all this data. Because when you're out of school, you're not thinking about the exam. You know what I'm saying? Like you're gonna you go, let's say, oh, I'm gonna take it in 3 months, but a lot can happen in 3 months. So you want to go and take it as fast as possible while you still have all that information fresh in your head. How do I know which resource is for me? There are so many different resources. So Sammy, this is where I ask you, what type of learner are you? Are you an auditory, kinesthetic, read, write? Are you a visual, right? So then use your learning style to figure out which review would work best for you. So in my review, I actually do it by lessons, and I have pictures, and I have, especially in my cardiology section, I actually have the heart rhythms, and you can see the rhythm strips and so on and so forth. So I try to make it very visual, and as well as I actually give you the PowerPoints that you can download and you can write on for yourself. So, it all just depends on what type of learner that you are. Like I said, you can check mine out. Mine is linked in the bio. It says, my eyes are tearing. I want this so bad. Or if you want it, stop telling me what you want and make it happen. All right. If you want it, go make it happen. Your crying is not going to get you a license. Your work is going to get you a license. All right. We use ATI in my school. I'm sorry to hear that. I didn't use ATI. I used HESI, but Amber will tell you that she hates ATI, and I don't like HESI either. It says exactly, we are taking Kaplan CAT on Monday. Okay. I'm a visual and auditory. Okay. So Sarah, that will be a good one for you. Test taking strategies is the key. Please be focused for at least 2 months. So she's telling you 2 months. I'm telling you at least 30 days. If you're coming right out of school, take it ASAP. If there's no if, ands, or buts about that. If you're taking it out of school, take it ASAP, because that data, that information is still there. Oh my God. I'm sorry to hear that. I'm sorry. Like, HESI was terrible when I was in school. I'm pretty sure it hasn't changed. ATI, I never took it. But if it was Nurse Amber, Nurse Glamber, aka Nurse Amber, who was another NCLEX strategist and a homie, she will tell you she is not a fan of ATI at all. So, but shout out to all 76 of y'all. Y'all got me to 37,000 likes, not 40,000 likes, but whatever. I guess I can't be greedy, right? But I appreciate you guys. HESI is terrible. I would agree. There's a book down there somewhere. I don't know where it's at. I kept the book. I don't know why, but it's down there somewhere. Sucks. I'm use your advice, 60 days to study and set up my NCLEX for 1 p.m. Okay. So that worked for me, Sarah. That worked for me. Now, if that works for you, then that's cool. The reason why I did it that way is because every time I did a test or I did a quiz or anything, it was around 1 o'clock. So I kept with that continuity that way. Now, if that's something that you set up for yourself, like if you're not a morning person and you're an afternoon person, cool. If that works for you, do it that way. All right. But there's more than one way to skin a cat, more than one way for you to study. Okay. Oh, ATI gives us an extra box of ew. Oh yeah, I heard about that. That sounds terrible. All right, what other questions do you guys have? I tried the AM NCLEX and it wasn't for me. I'm a morning person, or you're not a morning person. That's where I messed up. Okay, yeah. Then go in the afternoon. Hey, if you guys are just now joining, I just finished doing NCLEX questions. I think I did 20 or 25, something like that. 20 or 25 questions. Make sure you guys go over there, the nurseslabs.com. They are free sets of questions. You guys can go over there and check those out. All right. You guys can also check the link tree out in my bio where I have a free download, 42 pages. You guys can go over there and check that out for yourself as well. It says, I burnt my entire box of books. It helped zero. Hey, at least you don't got to get wood, right? You just light it up, throw it in the fireplace, or whatever. Hey, you're good to go forever, right? So what other questions do you guys have? Shout out to all 65 of y'all. Oh my God, I can't wait to do that in December. I bet. And you should just stream it. You should stream it on TikTok and be like, this is how I feel about ATI. Whew. And then watch them be like, can you take that video down? Oh my goodness. All right. So what are we thinking, y'all? What other questions do you guys have? I'm gonna hang out here for about another 5 minutes, 10 minutes. You should. You should do that. And then tag me and it'd be like, Kevin, look what I did. I'm gonna be like, oh my goodness. Hey, like I said, hopefully everybody had a really good weekend. I appreciate everybody still rocking here with me. A little bonfire and marshmallow. Hey, there you go. Well, I don't know. You can do the bonfire and the marshmallows and stuff, but you don't want those. You don't want the smoke and flames of ATI to be on your freaking marshmallows. It might like contaminate you. You know what I'm saying? How often do you get? How often do you get live? Do I go live? I go live on TikTok Monday, Wednesday, and Fridays at 5:30. Last week I was at a conference where it had really bad signal, so I couldn't have done any questions for y'all anyway. So, and plus that was my like week. Usually I take a week long break from doing TikTok. And so, hey, make sure you guys go over there and follow me on Instagram. You guys go follow me on YouTube because the way that it's looking, this bill has already passed through the House, right? And once it gets to the Senate, it's going to take all of that for that to pass. And then once that happens, it's going to the president and it's getting signed. So we could be losing the good old TikToks. All right. So I need for everybody to go follow me on Instagram and go follow me on YouTube. Those links are in my link tree as well as in my bio. I can't ingest any more ATI. I'm already at toxic level. Yeah, that's pretty bad. What's your YouTube name? It's at the Boot Nurse. But if you go to my main page, I have a YouTube tab that'll take you right there. That'll take you right there. All right. So, hey, what other questions do you guys have? What other questions do you guys have? Yeah, you're very welcome, Sunshine. Every time I say your name, there's a guy I was in the Navy with. His last name was Sunshine. And we used to sing that Remember the Titans from Sunshine, Sunshine. I'm always hearing those folks trying to take TikTok just about every year. Ain't that wild, though? Hey, but they're serious about it this year. They're serious about it this year. Like, they got a bill and everything for it. They're just like, get this shit out of here. But, all right. What other questions do you guys have? You love it? Hey, man, if you love it, I love it more. Thoughts on the decision tree? I like it. I like it a lot. I like it. So many people sing for me. I bet they do. But Megan, I think the decision tree is actually pretty good. I mean, you can do that in any way. The decision tree can be in any way. The Instagram is at the Boot Nurse. So if you go to my link tree, you'll see the follow me on Instagram tab that's down there as well. Is it true that NICU nurses get sued the most? That's a good question. That one I'm not too sure on, to be honest. I just know that nurses, NICU nurses, OB nurses, probably. I'm not too super savvy on those statistics, at least. I would have to ask one of my friends who works NICU. She'd probably be like, yeah. I'm like, oh, damn. Okay. All right, y'all. Y'all got me to 41,000 likes. I appreciate y'all. Smash that. All right. What other questions do you guys have? Hey, yo, we're doing grilled cheese and tomato soup today, bro. Grilled cheese and tomato soup. What do y'all know about that? Nothing. I mean, some of y'all do. That's where I wanted to go, but my brother is trying to talk me out of it. Go where you want. Go where you want. Listen, if you know that you're going to be a good nurse, and if you know that you are a good nurse and a good person, and you always cover your ass, aka your charting, everything, your conversation. Remember, everything that you say and that you do while you're at work is recordable and can be held at court. All right. If you know that you're a good person and you know that you're a stellar ass nurse, go to the NICU. All right. But just like everything, especially when you're taking care of somebody, especially when you're taking care of somebody's child, an infant, neonate, you have to be very, very on your toes because like any parent, they're going to hover. They're going to want to know what you're doing. All right. So NICU is definitely one of those places you need to be shit hot. You need to be shit hot. You really do. And that's not to scare you. That's just the truth. Because think about it. If you had a baby and who was a preemie or neonate or, for any reason that baby needs to be in the NICU, you're going to be hovering too. And it's even worse as a nurse because you're going to be like, you know what's supposed to be done. And you're like, hey, what the fuck? So just something to be aware of. All right. Hey, if you guys are just now joining, we did NCLEX questions. If you guys are just now joining here, my name is Kevin. I've been a registered nurse for almost 4 years. I worked ICU, OR, and PACU. I was in the Navy for 16 years. Hence that, that thing right there. Last 9 years of my career, I was a master instructor. Taught a whole bunch of other programs as well. But what questions do you guys have about nursing, about NCLEX? Like I said, I'll hang out here for a little bit. What questions do you guys have? Hopefully everybody had a really good weekend. You guys have a really productive week coming up. So hopefully that'll do well for you. All right. But what other questions do you guys have? What other questions do you guys have? April, thank you for the share. I appreciate you. Like I said, we just got finished doing NCLEX questions. We just got finished doing NCLEX questions. So what other questions do you guys have before I decide to vacate? All right. No questions, huh? No questions. Look at that. All right, cool. Well, hey, since y'all don't have any questions for me or any more questions for me, I'm going to go ahead and I'm going to bounce so I can go. Wait, yeah, the door's over there. The bounce. So make sure you guys go over there. This is not a shameless plug because I am not ashamed of anything that I'm building for myself. So what are your thoughts on new grads entering specialties versus a year of med surg? Go to where you want. Go to where you want. All right. Now, if you had somebody like Nurse Amber, not Nurse Amber, but Nurse CC up in here, they'll tell you to go to med surg first because they want you to build your skills. But you can build your skills. It depends on how fast you want to build. You want to build them. You want to go to ICU, you're going to build them super fast. If you want to go to NICU, you're going to build them super fast. But it all just depends on you. It really just depends on you and where you want to go. I went straight to the ICU. I never went to med surg. I went to ICU, then I went to PACU, then I went to the OR. So it all just depends on you and where your heart desires. And if you don't understand or if you don't know where to go to the, look, you can go to the ER. You can go to the ER and go get you some. And by that, I mean the controlled chaos that goes on down there. You can do that too. All right. It all, like I said, it all just depends on what you want to do. I'm joining a nursing program in Canada. What do you think about being a male nurse? I love it. I love being a male nurse. I get treated really nicely. You know, I had a few older nurses try to be real funny. And by real funny, they were real condescending to me. And then when I checked them, they didn't do it again. It's kind of weird how that works. So there's that. I don't mind being a male. I don't mind being a male nurse. Most of the ladies are super nice to me. They always ask me to turn their heavy patients. And while I don't mind helping them turn their heavy patients, I don't turn their heavy patients all the time when I used to do that. But we worked as a team, which was really great. So, but being a male nurse is cool, man. I liked it. I like it. I like being a male nurse. I don't mind it at all. Male nurses in my program are loved by our teachers. I bet they are. What days you do the NCLEX review? So I have an NCLEX review coming up that I'll be doing May 3rd to May 5th. That link is in my bio. So if anybody is interested in doing a 3-day live NCLEX review, it's not on TikTok. It's off of TikTok. If anybody's interested in that, you get to do the 3-day live review with me. You get the live recordings as well as you get access to the 7-day NCLEX course, as well as you get access to my community, and you get my 700-page ebook. All comes with that. So you guys can check that out. Like I said, that's linked in my bio, and you'll see it. It'll say review May 3rd to May 5th, which is live. So you guys can go over there and check that out. All right. Now, when I do these reviews here, it's Monday, Wednesday, Friday, 5:30. Or when I do these questions here, it's Monday, Wednesday, and Friday. But the questions, and I go over things a lot more thoroughly and more in depth during my NCLEX review. All right. So if you guys want to go over there and check that out, you most definitely can. Like I said, that is linked in my bio. If you tap my face here and then you tap my face again here, it'll take you to my main page. Okay. So But all right, y'all. Shout out to everybody that just now joined. Shout out to everybody that came through the whole TikTok and stayed all the way. Hopefully, I answered everybody's questions and everybody had a really good weekend. Like I said, last non-shameless plug. Check out everything I have going on. Make sure to follow me on YouTube and TikTok, or YouTube and Instagram, because we don't know what's going to happen with TikTok. All right, I got a free download over there, plus an ebook. If you're looking for doing coaching, that tab is in there inside of my link tree as well. And I have an on-demand NCLEX course that has 80 videos, 80 videos that are in there that are super helpful. All right. And yes, listen, y'all, I've helped over 2,000 people pass NCLEX. I've helped over 2,000 people. Proof is in the numbers. All right. And I got them right here. So in some way, shape, or form, I've helped over 2,000 people pass this exam. All right. So I'm telling y'all that because it works. I'm telling y'all that because it works. All right. So make sure you guys go over there and check that out. And lastly, be kind to yourself. Some of y'all are beating yourselves up because y'all aren't able to pass this exam. Some of y'all are beating yourselves up because y'all are not passing this exam. Listen to me. All it is just an exam. It has no type of emotional ties to you, but you give it all the feeling in the world. All right. This exam doesn't change. Know thy enemy. So if I know what my enemy looks like, if I know what my enemy looks like, if I know what they're going to do, if I know what they're going to be at, if I know their terrain, if I know how they act, I have my plan of attack is going to be so much easier. I know what type of questions are going to be on there. I know what category that they're coming out of. I know where it's located. I know who's going to be there. I know all that stuff. If you know it, and if you know thy enemy, I'm trying to tell you, you can conquer this exam. You can conquer it. All right. My man said, great encouragement. Hey, that's what I do, man. That's what I do all the time. All right. But of course, like I said, go check out everything I have going on. Make sure you guys turn the notification on so you guys know when I'm going live. I hope to see everybody's bright, shining face here on Wednesday. All right. But until then, everybody have a good, next couple days, and I will see you guys on Wednesday.